I will call the meeting to order. Please rise for the Pledge of Allegiance. I pledge allegiance
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
This is an open meeting of the Seward, Nebraska governing body. The city of Seward abides by the Nebraska Open Meetings Act in conducting business. A copy of the Nebraska Open Meetings Act is displayed on the north wall of our meeting room facility as required. Disclosure of meeting recording processes is also posted here in the meeting room. If anyone wishes to speak, you can message Greg and let him know, and then Greg can coordinate that during this meeting. If you do speak, we'd ask you to state your name and your address for the clerk's record and limit your remarks to 5 minutes. All remarks shall be directed to the mayor, who shall determine by whom any appropriate response shall be made. And the city of Seward reserves the right to adjust the order of items on this agenda if necessary, but that should not be an issue this evening. So please call the roll.
Schmidt.
Present.
Wilkin.
Present.
Miller.
Here.
I'm going to unmute a few. Beck.
Here.
Camprith.
Here.
Coulterman.
Here.
Singleton.
Here.
Hendricks.
Here.
I believe all present.
Okay. The only item this evening is the administrative item, which consists of an ordinance to adopt a directed health measure through May 3rd, 2020, and lift restrictions on certain businesses in the city of Seward on May 4th, 2020. Just to give some background, Greg and I in particular have been monitoring what's been going on at the state level as well as Lancaster County. There's been a number of directed health measures that have been issued since the COVID-19 coronavirus pandemic started. It's been a little confusing just because some of the dates have not lined up with the different health measures. And so the state of Nebraska, the governor has theirs, which was to, I believe, lift for Seward County on May 4th. Ours is May 6th. And then the Lancaster County directed health measure is May 11th. And so I was getting some calls and some questions from local businesses wanting to know which of those deadlines applied to Seward and to them specifically. And so I said that at this time, the May 6th date is still the one that applies to the city of Seward unless the council decided to change that. Obviously, the council can change it to whatever date they want or not change it. The two other dates that are out there, like I mentioned, are the 4th and the 11th. My hope was that we could be consistent with somebody so that the public knows what to expect and can act accordingly. I know a lot of the businesses that have been closed are having questions from their clientele wanting to know when they would be open again. And so that's why I called the special meeting this evening, was to give the council an opportunity if they wanted to move the date up. But of course, because like I mentioned, our next meeting then isn't until the 5th, which would be too late. So that's why it was necessary, I felt, to call this meeting. I know there's a number of local business owners represented here tonight on this Zoom meeting as well, and I hope to hear from some of them of what their thoughts are, as well as any concerns that they have. But keep in mind, even if the council decided to align with the state's DHM and moved it up to the 4th, it doesn't require any business to be open. So if you have clientele, if you have clientele or employees with concerns, you of course can just wait and decide when it makes the most sense for your business to reopen. But at least have the council, give the council the opportunity to decide on that while they still can. So Greg, did you want to take it from there?
Yeah, as mentioned, a lot of dates have passed by. Back when this original ordinance was set in place, we were unaware that the state was going to do a full statewide ban on hair salons, nail salons, massage therapy, and the like. And so we set ours, and then 2 days later, the state implemented their statewide health directive. So now we just need to kind of get in the line so people have reasonable expectations of when they can open up for business. We knew that the prior discussion was based on Lincoln Lancaster County and their initiating their own health directive, which closed down all these businesses for the time being. And at the time that our council passed our ordinance, we were unaware of how long we would be in that situation. The one thing I will say is different is here is we know that Lincoln will only be approximately a week behind us should we open up for business on the 4th. So we're passing the original one. We had no clue what the difference between the city of Seward and Lincoln Lancaster County was going into it until the statewide ban took place. So I know it's been very confusing for people because we have the statewide one. Lincoln and Lancaster County can kind of do what they want separate from the state, but they've tried to work in cohesion with the state on this new directive for June or May 11th. And so really it just comes down to the council not making a decision about what date is appropriate. I will note at the request of the council, we do have Roger Reamer from Memorial Healthcare and Laura McDougall, the executive director of Four Corners Health, on the line with us. And so if someone would like to get any sort of questions answered or updated first before we turn it over to maybe public comment, to be diligent of their time, we can do that at some point. That's all I have.
Did Laura or Roger want to say anything at this time, or it's just field questions?
I think at this point, and I can unmute Laura just so we can get to that point, but I think it'd be best to turn it over to the council first, start the discussion, and then see who amongst the council has specific questions about what's going on in regards to the citywide and countywide response to COVID-19.
Okay.
Laura, I had a couple of questions if I could. You provide an update on PPE and how you are seeing Seward and situated with Crete and with Grand Island, and we're kind of in the middle of several hotspot areas. Where do you see us going as far as projections for the next few weeks and cases? So PPE and cases.
Yes, so we are doing our best. We're getting some, we'll be receiving here soon in the next day or two, or I guess it's the weekend, so it'd be Friday or Monday. We expect to receive some more PPE. And we'll be distributing that to, we still haven't filled even the very first orders of our top priority groups in terms of PPE for our district. So we have quite a few high top tier response agencies that still are needing PPE. Hopefully after this next shipment, we'll get most of them into a good situation. So that'll be fairly soon. We are seeing our cases start to, today we had 3 cases today, new cases, and 1 was in Seward County. So we really expect with what's going on around us that we're gonna see some more cases coming in from around us in the future. So we probably, I don't expect us that we're really peaking yet. I think we're still gonna see that.
Okay. Roger, from the hospital's perspective, are you still in the same mode? Is everything still the same as far as preparations?
Yes, thank you. Can everybody hear me okay? Just make sure I'm connected. Yeah, on the hospital side, our PPE situation is very good. We've been fortunate enough to be able to get our PPE and had some in stockpile. So, we're in good enough shape there that we're able to start with elective surgeries starting on Monday. And so there's folks that have been waiting quite a while for some things that need to get some help with. And yeah, I would echo with Laura. We're anticipating we're going to see more cases. The hospital itself hasn't had any inpatients for COVID-19. Everybody that we've transferred off to Bryan or St. E's, who had potentially been COVID-19 patients, they've all come back negative. We're able to do a lot more testing than we were doing before. Since April 15th, we've been testing everybody that has symptoms. We haven't been just quarantining them. We've been testing them and then quarantining them. And you know, we got an eye on Saline County. I think that's where we've got obviously some potential to gain more cases. And but we're prepared for that. Our relationship with Bryan and St. E's and Lincoln is a very fortunate relationship. They're doing very well. They've got the capacity that they need even through the surge as they're predicting it. So we feel very good about that and feel like we're in pretty good shape.
Thank you.
Hey, Roger, are you planning on starting elective surgeries then on May 4th?
Yes, we are currently scheduling surgeries for the week. Yes, we meet all the requirements regarding the PPE, having enough PPE, having 30% of our beds available, having 30% of our ventilators available. So we feel no real concerns there. Our staff are going to be well prepared with their PPE that they'll be using. Of course, we still have the no visitor policy in place. All the screening will still be in place. Everybody coming to the facility as patients and staff will be screened. Even the day of surgery, the surgeons will be screened as well. They'll be coming in from out of town with temperatures. And so we think we've got all our protocols together and are looking forward to helping folks that need those surgeries.
Well, I guess I agree with the mayor on the point of we need to choose somebody who we're going to follow so that we're not doing this because Lincoln did it. We're not doing this because the governor's doing this. We're not doing this because whoever it is. We need to pick somebody and roll with them. We do need to look at ourselves though too and make decisions that are best for Seward and what we need to do in Seward. I feel I'm going to use the word sheltered from what's going on, not to say that it's not a risk, but when you compare it to things going on in other communities and what's happening, we have fared pretty well in Seward. And, you know, all we can do is credit the citizens, business owners, and everyone else for doing their part. It's scary because we don't know, but at the same point in time, we have people who need to get back to work, earn a living. Our directive was pointed directly at the salons, and they tend to be part of jokes around here because we have a lot of salons, it seems, in Seward. So the scary part of that, I think, is that for some of us is the people coming in from outside the county and what's going on. I think Lincoln had 44, 46 cases today. So, you know, it makes us, it can make people nervous from that standpoint. I have a child who's high risk. But at the same point in time, I think it's important to get these people back to work, let them earn their living and do what they do. I would hope everyone would pay attention to the directives that have been put out there as far as wearing the mask and doing that. The reality is these people can go into restaurants. That wasn't part of our directive. Restaurants are going to be open. People are going to be in there. I think if we follow the guidelines that are put out there and keep things safe, there's no reason to push this out further. We can lift it, stay in line with the state and what's going on there. And if we see a change, I mean, we have the right to come back and put it back in place.
Yeah, this is Jessica. I agree. I would pretty much echo everything Chris said. I feel like our health district has been very well protected, and I think that's a credit to our citizens who have really followed the social distancing and stayed home. You know, I work in a place where that is not the case, and so I've been around it a lot more. I think I guess I would just encourage, I know we have a lot of salon owners on the call. I trust all of you. I think you all do a great job. I would just encourage you to be mindful of the larger groups in your salons and, wear the masks and do what you can to protect yourselves and each other and the community. And then I kind of echo the concern about people coming out from other places, but with Lincoln following shortly after, our time frame that we're at now, I think we're going to open up and we're going to ease into this, and that's probably the right way to do it. I have no concerns with matching the state, which I think expires Saturday, or we can just let it expire on Monday. I'm fine either way with that, but I probably would not want to move it to the 11th.
Any other members of the council have any questions or comments? We have a number of guests on this meeting this evening. Greg, has anyone messaged you wanting to say anything?
I have not gotten any messages. So if somebody sends something on the chat that wants to say something, we can give you a little time. Just send it to the City of Seward, the host on there on the chat. Let me know that you want to speak. We can get you on here. And if nobody wants to speak, then we'll turn it back to the council and try to make some decisions.
And while we're giving you a few moments, if you would like to speak, I would also just echo what Jessica said. If the reason we were waiting to see what the state and Lancaster County decided this week was because if Lancaster County was going to keep theirs closed for an extended period of time, like weeks or even another month, then I think the equation would be different as to what we might want to do here. But given that we're talking difference between the 4th and the 11th, I don't know that the risk there is that much greater. So, Greg,
Mayor, we do have a public comment. And so I'm going to turn it over to Terry. Terry, when I unmute you, identify yourself, your first and last name and your address.
Okay.
Go ahead.
Hi, I'm Terry Blowbaum at 161 Plum Creek Lane.
Go ahead.
I am the owner of Sheer Reflections. My question is, does the receptionist that is probably 20 foot away from the customers need and behind a desk that's pretty high, does she need a shield or will she need a mask? She won't have nothing to do with being by a customer. She will just be doing book work.
And I might turn that over to Laura.
Okay.
Sorry, Laura. Let's see if I can get you unmuted here. There you go.
Thank you. I have dogs barking in my house, so I probably need to stay on mute most of the time here. That is, I don't think that's actually addressed. I do not have the official copy yet of the directed health measures that are coming out. So they told me I was supposed to get those today and I haven't gotten them. I can ask. I would suggest it would be a good idea to have a mask.
A mask handy, or because she will not be in any contact. We have a well ventilated area. It draws out how many units, pumps out lots of air. So we have fresh air with the back door open. So it sends it right out the alley. I am by the alley. So I felt that from the get-go, I had done all the measures, knew everything, sterilized everything, sprayed chair down, everything. I was very cautious. There's 2 people in my salon that work, and our area is how big?
80 or 60 by
60 by
about 40.
60 by 40 area for 2 people working is a lot of space, and we're using very much distance. And so my receptionist is another at least 15 to 20 foot away. If we would get shields that go all the way around the desk. She's got claustrophobic, and I would like her to be able to work. So if she had a mask and was closer than 20 foot of a customer, she could put that mask on.
Laura, did the state though? I know they haven't put out the actual DHM yet, but did they, in their press release, did they not include some guidance or guidelines as well? Would that help give some direction as far as these details that won't be included in the DHM? Because I don't think it'll go that specific, other than number of people, spacing, that kind of thing. But is that right, Laura? Could we maybe get that to people to help?
Yeah.
The state right now has they've put out guidelines for churches and
Okay.
everyone but the salons. And
Okay.
that is coming. It's still getting worked out. It's supposed to be coming before the 4th, but we do not have that information yet.
Okay.
All that I know is right now they're just saying that beauty nail salons, with my draft copy of the directed health measures, beauty nail salons, barbershops, yada, yada, shall require the use of masks or other items sufficient to cover an individual's mouth and nose for all staff, practitioners, and patrons. So I don't think at this point I would worry about a shield. I would wait and see if they require the use of a mask. It looks like it's going to be that they'll require the use of a mask, but I would wait. There's supposed to be guidelines coming out.
Okay.
Thank you, Terry. Anything else?
Yeah. No. No, thank you. We understood everything, that we would be wearing the mask. I would just, because we will be that close to our customers, but she will not. That was my question.
Okay.
It'd be almost like a whole different room. So, okay. Thank you.
Anyone else, Greg?
I have not gotten any other ones. So I'll just continue to reiterate, it has been very frustrating not having these DHMs come out in advance. As Laura said, some of this stuff is supposed to expire tonight, and we still don't have officially signed DHMs for our health district. And so that's been a frustration for us. I think the first countywide DHMs came out on a Friday at 6 o'clock, which is also not helpful. So, but we're trying to do our best and communicate and educate and do those things. So again, before we do vote on this item, if anybody wants to make any other comments, or before we turn it back over to the council, shoot me a message on the chat, and then I will recognize you and unmute you. I'm going to unmute Sandy. Sandy, give your name and address, if you will.
I'm Sandy Dobish, 2417 280th Road, Seward. I'm from the Salon Selah. And first of all, I just want to thank everybody on the council for allowing us to come in tonight to watch and participate during this meeting. It has been very stressful for the majority of us, but we want to do what's right. But I did want to say then about something about the people coming in from other areas. I pretty much can guarantee you that we are also going to be so packed with the people that we have here with our clients here in Surrey. We're not going to have time to have people come in from other cities. I've had already 4 or 5 calls today from people that live in Lincoln, that live in other areas around Seward that want to come in, begging to let them come in. And it's like, no, we can't let you come in. We are not even approved to come in yet. But if we all say that we're not going to allow them to come in, I think you guys can have our word. We will not allow them to come into our salons. So I just wanted to thank you again for letting us come in and visit, and appreciate everybody listening to our thoughts about this thing that's going on in our lives right now. It's very important to us.
Thank you, Sandy, for those comments. And just to be clear, we are not prohibiting anyone from coming in from out of town. for your businesses. We also assume that you would be busy with your normal local clientele anyway, but we're not banning anyone from coming into Seward for that purpose, just so that we're clear. Right, Kelly?
Kelly's nodding. We got a thumbs up. There we go.
Any other comment? Go ahead,
Let's see here. I believe this is Tina. I'm going to see if I can find her because it just says iPhone. So we're going to try it and see what Tina has for us, okay? Tina, are you there?
Yep, I'm here.
Go
and
ahead, Tina.
Josh just basically answered my question, you know, because we do have some clients from Lincoln, you know, David City. I mean, as long as we have done them in the past, it's okay for us to let them come. Is that?
They can, anybody can come at any
Right.
time. It doesn't matter if it's a new client or a current client. My point was just, I'm hoping there won't be like a mass exodus from Lincoln to come to Seward. That's all I was saying.
Right. Like, yeah, I mean, if it's our regular clients, yes. I mean, if it's like new client walk-in, I would say no. But I just want to make sure like all of us are on the same page. So
Sure.
we're, you know.
Yeah, we would just
together.
ask that you just use common sense as we
Okay.
move forward through this time period, and you know, we'll get through it together, and hopefully we can all laugh about this maybe someday, just not today.
Yeah.
Tina, real quick for my purposes, Tina Shaben. What's your address?
217 East Seward Street, Seward, Nebraska.
There we go. Thank you. All right. Mara, I have no one else that has sent me a message on chat or any other questions, so I will turn it back over to you.
So at this point, unless the council has any questions or comments, we would need someone to introduce the ordinance. And just to be clear that the ordinance as drafted would be to match the state's, which would allow the businesses to be open on May 4th. If that's not the intention of the person making or introducing the ordinance, and you need to clarify that you're doing something else. But that is the ordinance that we have presented you at this time.
I'll introduce the ordinance.
Okay?
Introduced by Camprith.
Yes. The ordinance is introduced by Camprith. An ordinance to adopt directed health measures through May 3rd, 2020 to help prevent, limit, or slow the spread of the novel coronavirus COVID-19 among the citizens of the city of Seward, to repeal ordinance number 2020-11, to provide for publication of this ordinance in pamphlet form, and to provide for a time when this ordinance shall take effect. The ordinance has been read by title and is designated as ordinance number 2020-12, and the title is hereby approved. I need a motion to dispense with the statutory rule.
So moved.
Is there a second?
Second.
Moved by Schmidt, second by Miller.
We have a motion and a second. Is there any further discussion from the council? Seeing none, please call the roll.
Schmidt,
Yes.
Wilkin,
Yes.
Miller,
Yes.
Coulterman,
Yes.
Camprith,
Yes.
Beck,
Yes.
Hendricks,
My true character says yes.
Singleton.
Yes.
Motion is adopted.
Okay.
Or passes.
Again,
That
this
was
is-
just the statutory rule, was it not?
yes,
That's
to-
correct.
Yes, to dispense the statutory rule. The next one will be for the ordinance itself. So this, again, this is ordinance number 2020-12. Would anyone like to move that this ordinance be passed and adopted as read?
I'll move.
Is there a
Second.
I'm going to go with moved by Coulterman, second by Camprith. There we go.
Is there any further discussion from the council? Seeing none, the question is, shall ordinance number 2020-12 be finally passed and adopted? Please call the roll.
Schmidt,
Yes.
Wilkin,
Yes.
Miller,
Yes.
Coulterman,
Yes.
Camprith,
Yes.
Beck,
Yes.
Hendricks,
Yes.
Singleton.
Yes.
All right. The ordinance is adopted. I'll need one final motion to make this ordinance part of the permanent record.
1 minute.
So moved.
So moved by Singleton.
We have a motion and a second. Kelly, did you want to add something?
Is he waving at me?
Yeah.
All right. Oh, I think he's going to want us to do, hi, Kelly.
Hi. Can you do one separate motion declaring this an emergency so you can have immediate publication per section 6? I think we did that the last time as well.
Would someone like to make that motion?
So moved.
Moved by Schmidt. Do we have a second?
Second.
Second by Camprith.
Okay. Please call the roll.
Schmidt,
Yes.
Wilkin,
Yes.
Miller,
Yes.
Coulterman,
Yes.
Camprith,
Yes.
Beck,
Yes.
Hendricks,
Yep.
Singleton.
Yes.
Are we good, Kelly, then to, okay. So next, the final thing we need to do is make this a part of the permanent record. Okay, is there a motion?
So
I'll
moved.
make him.
Moved by Wilkins, second by Coulterman.
We have a motion and a second. Please call the roll.
Schmidt,
Yes.
Wilkin,
Yes.
Miller,
Yes.
Coulterman,
Yes.
Camprith,
Yes.
Beck,
Yes.
Hendricks,
Yes.
Singleton.
Yes.
In a minute.
All right. Thank you, everyone. Greg, did you want to add?
Mayor, if I may, Laura and Roger, thank you guys so much for joining with us tonight again. I know you guys are very busy, have a lot of these meetings, but it was informative and we were glad you're here. Thank you so much.
Chris, did you want to add anything?
Welcome. Thank you.
Well, I mean, we made the comment early on about who we're going to follow from a directive standpoint. Is it going to be the state? You know, what are we going to do? We make the comment, but is that going to be something coming down from you and Greg as a recommendation? What are we going to do? Because we kind of still left that piece hanging, because I guarantee this stuff isn't done.
Well, I think our generally speaking, you know, we're going to look at the state and Governor Ricketts for their directed health measures. That's also what I believe Four Corners, not to speak for Four Corners Health Department, but that's also what they're looking at as well. I think last time we did what we did, the reason we brought that to the council was that we had heard a specific concern from Four Corners that was potentially coming from the residents of Lancaster County. And so that's why we responded to it the way we did. I think generally speaking, I would recommend that we follow the state's DHM unless there is a very specific reason we shouldn't or should consider Lancaster County just by the fact that our populations move back and forth so much. And I mentioned before, you know, Lancaster County is on May 11th. If it were going to be 3 weeks, 4 weeks, a month and a half later, and we started seeing these issues again, and there was a concern, then I think we would have to address that as well. But given that we're talking about basically a week difference, I don't know that concern is as great. But again, that's why I wanted to bring it to the council so that you'd have an opportunity to make that decision, since our next council meeting would be after that May 4th deadline. Greg,
Yep.
do you want to add anything?
And that's, I'm good with that. I just wanted it stated that in general, we're going to be following the state unless something else dictates a reason to make a move. Just so people know, especially the number of people we have on the call tonight, so they know what to look to and what to expect.
What made it difficult the last time was just that, you know, the state took action with their DHM, but it was 2 days after we recognized the issue and wanted to deal with it. And so our cart may have gotten ahead of their horse a little bit in that regard. And if they had done it sooner, we wouldn't have had a reason to have taken action. And so it's just sometimes it's the timing, and we're dealing with so many different jurisdictions and government entities trying to get everybody aligned on the same page is sometimes a challenge. But Laura, did you want to add anything?
I did. And thank you for letting me add a comment in. I would like to just say that we do these calls every Tuesday and Friday afternoon with the Unified Command, which the city of Seward usually is on those calls. Well, I don't think you've missed one actually. So we have the city on there, and that's where we talk over a lot of decisions too. And I really try to give the best update I can as to what cases are looking like around us and what's brewing and what some of our barriers are and our successes. So we have some really good discussion around that. And at this point, we're kind of in a waiting mode to see how much the hospital, I know the governor's making his decisions based on hospital needs right now. So, and he feels that we have a lot of capacity in our hospitals yet. So we'll be monitoring and ongoing with the city of Seward, and they'll be informed, and hopefully that'll help you make decisions.
And there's a reason why some counties are still under a different DHM, because they have additional restrictions still on them as well. So thank you for that, Laura. Greg, did you want to add anything?
No, we just continue, and I know that the governor has reached out in some way to Laura and Four Corners in trying to decipher what the makeup of our specific Four Corners DHM will look like. But for now, it's going to match those other ones that are going to open up on May 4th. But again, if we see significant rises in testing rates, fatalities, anything like that, then you're going to see the governor adjust the Four Corners Health one. Specifically, probably. And so we'll just continue to look at the numbers. The state DHHS will look at the numbers, and our unified command team will look at all that data as well and try to keep the information going back and forth. The state did a better job on this one of giving us a lot of heads up before they did it. I mean, we're still sitting here talking about it, and they haven't officially done it yet. Where when they closed down the salons statewide, they didn't tell anyone, they just did it. And so going out of it, it seems like communication's a little bit better. And that's what we'll try to continue to do, is keep communication up and monitor that back and forth amongst everyone.
Okay. Anyone else? Otherwise, I don't have it on the agenda as far as upcoming events, but since I see Jonathan Jank on the call, is there anything you wanted to add, Jonathan?
Yeah, thanks, Mayor. Just really briefly, we do have the time promotion that is launching officially tomorrow. I just want to say thanks to the donors that are behind that. And I know many of our salon owners are participating in that. So time promotion is an opportunity to buy gift cards and gift certificates to support our small businesses actually throughout Seward County that have really been impacted greatly by COVID-19 pandemic. So would highly encourage that you participate in that. And we have donors that are helping match those funds up to a specific amount, but really would ask you to have kind of a pay it forward mindset. This is a great opportunity to support our small businesses, our neighbors and friends, and those that support our little leagues and our schools. Now is the time that we need you to help support them. So please consider going out, buying gift cards, gift certificates to all businesses, but especially those participating right now to help support them in this time promotion. Thanks, Mayor.
All right. Thanks, Jonathan. So with that, I would entertain a motion to adjourn.
So moved.
So moved.
Moved by Schmidt, second by Singleton.
Please call the roll.
Schmidt.
Yes.
Wilkin.
Yes.
Miller.
Yes.
Coulterman.
Yes.
Camprith.
Yes.
Beck.
Yes.
Hendricks.
Yes, please.
Singleton.
Yep.
We are adjourned.
All right. Thank you, everyone. Have a
Thank
great
you.
night.
Thanks, Greg.
Thanks, guys.